All right, folks, we're going to talk about the upper and lower extremities of the venous anatomy. Lesson objectives for this lesson. Location and function of the veins of the upper extremities and where these veins carry the deoxygenated blood. All right, lower extremities. All right, it's kind of interesting, and just notice how actually with a lot of veins, they have the corresponding name for the arteries, or you say vice versa. So here you have the common iliac vein, all right, showing like right here, if you will. We can kind of get in there, right? Guess what? Common iliac artery, all right? The internal iliac artery, okay, right here. Well, guess what? Conversely, you have the internal iliac vein right here. The external iliac vein right here. The external iliac what? Artery. All right, and goes on and on. So, and you have the femoral artery, femoral vein. Okay, so a lot of the veins and arteries there, it's just almost like you have the name of the vein, flip the coin, and that's the same name. You just put artery at the end. So that's something that's very important and mindful to know. That is something that you see, for pretty much for the most part, as it relates to human anatomy. Okay, so basically here is the lower extremity. All right, popliteal vein collects blood from the knee joint. Okay, so this is vein. So again, we're talking about the veins. Again, taking deoxygenated blood from the leg or from the body to take the deoxygenated blood back to the heart. And then you have the small, all right, saphenous vein, all right, and that's just relatively large, superficial, kind of close to the surface vein of the posterior leg, all right. And then here we have the great, all right, saphenous vein. Again, a large, right here, it's one right here. See it here, right there. Okay. Superficial vein of the leg, the longest vein in the body. So know that. All right, so the longest vein of the body, running length from the lower limb, returning blood from the foot, leg, through the thigh, and deep into the femoral vein. All right, and it makes sense it's the longest leg of the body because usually your legs are, in terms of maybe compared to your arms, pretty long. All right, so yeah, so that's basically again, and then you see the posterior part, and you got the fibular vein, popliteal vein, interior tibial vein. All right, so you got the anterior portion of it and the posterior portion of it. Again, just another look at the veins. All right, so you got the femoral vein, carrying a lot of blood, has a wide diameter, so that's carrying a lot of blood. All right, popliteal vein and the tibial vein. Again, these guys are going to return back, going up towards the heart, returning the deoxygenated blood. All right, one thing that's interesting about veins is the fact that veins have valves. So what happens is that the valves open, all right, as blood's being pumped, the deoxygenated blood's being pumped through on its way to the heart. And and these particular veins can be, either in the legs, we're talking about here with the extremities. So lower extremities, upper extremities, abdominal cavity, the brain. Nonetheless, or anything, so you get the valves here. And then what happens is that actually as blood goes through, the valves are supposed to close so that the blood does not seep back through. There's an issue if the valves do not close all the way, but under normal conditions, the valves are supposed to close, like the valves that separate the right atrium with the right ventricle, the left atrium with the left ventricle, and those valves. So just the function of them, the functionality of them is to close so that blood does not rush back. All right, you probably heard of this, varicose veins. Basically, again, like I said, the valves are more so like a one-way to keep the blood moving towards the heart. But again, there's times that the valves do not work well, and then it allows blood to come back, and the blood pools. Blood pools there, right? Got this from this is the site here from Adam. They got some great images there, so I gotta talk about them. So the varicose veins are enlarged, swollen, and twisting veins, often appearing blue or dark purple. Excuse me. They happen when faulty valves, again, we talk about the valves, we want the valves to be working well, but happen when faulty valves in the veins allow blood to flow in the wrong direction, to pool. So again, here is a scenario where that the valves are not working under normal conditions. You have the normal vein here, all right, normal closing of the valves. Well, here, varicose veins. And then again, the valves, in this case, they kind of tried to close, but then close fully. You got pulling of the blood, and that's what you're going to kind of see, the varicose veins there. That's what's happening. Compression socks can be a good idea, and that's some things what patients use either in hospitals or at home. Again, you have the valves where that they cannot close because you want the blood, say, to run this way. All right, but valves are not closing. Again, as I showed in the previous slide, you're gonna have the blood pooling. It's going to have the veins popping out and just turning just like that bluish color. Yet again, the blood is not blue. All right, deoxygenated blood is not blue, but it appears as blue. All right, and the veins appear blue. So there's unhealthy veins. Whereas compression socks, what happens is that it puts pressure. All right, kind of maybe squeezes the veins a little bit more, so puts a little more pressure on it. So to decrease the likelihood of blood flowing back in the wrong direction. Okay, so that's the purpose in large regarding compression socks. So yeah, upper extremities. Again, not going so much in the detail, but you see the clavien, okay, the subclavian. Well, you have the subclavian vein, you have the subclavian artery. You can see the auxiliary vein. You have the auxiliary vein, you got auxiliary artery. All right, brachial vein, you also got the brachial artery. All right, radial vein, got radial artery, ulnar vein, got ulnar artery. The digital veins, got digital artery. So again, their main role, all right, is to return the blood back to the heart. And the different colors here is this. We have the deep in the superficial. A lot of times, the deep veins, the ones that are deeper. I think I may mention this when I was talking about the arteries, maybe like last week or at least at some point in time. The bigger ones tend to be a little bit deeper because you don't want them on the surface. Because if you get cut, you run into something, you kind of get cut. Of course, the surface is going to be the first part that's going to get cut. Now, it can go deeper, but if you just have a superficial cut, you're going to be bleeding, but not much. All right. Just think if one of these deep veins, was actually not a deep vein, but a superficial vein that carries a lot of blood, or the arteries, and that person is going to lose a lot of blood. And again, just another picture, internal, the jugular veins, and you got jugular arteries, and this is just kind of just showing the same, a very similar thing, just a different picture, what I talked about on the last slide.